Now, for healthcare workers on the front lines, there are countless concerns. Their patients, their safety, plus their own families who worry about the risks they take every day. Perhaps no one understands that more than my colleague, our own CGTN's Jim Spellman.
I usually wouldn't interview a family member for a story, but one of the first people I call or text whenever I'm covering a disaster or any kind of public health crisis is my sister. She's a registered nurse and a volunteer firefighter and EMT. She's on the front lines of the fight against COVID-19. She works at a hospital outside Baltimore, Maryland, and spends much of her free time here at the Pikesville Volunteer Fire Company. The hospital and fire station are bracing for this outbreak to get much worse.
Sounds like the positive patients that we have now are just going to keep multiplying as more people were tested.
They receive guidance on an hourly basis on how to best handle patients who may have contracted COVID-19.
Right now, it just changed to an N95 all the time if you're going to be within 6 feet of a patient.
Scott Goldstein is captain of the firehouse. So tell me about the N95 mask.
This is actually what protects us.
Like first responders and medical professionals around the U.S., they're dealing with a shortage of masks and other supplies.
Due to the tight shortage, at the moment we're essentially recycling and reusing.
It is vitally important to prevent first responders from contracting the virus. If one firefighter becomes sick, it will likely spread to others, reducing their ability to respond.
When people do dial 911, somebody has to be able to show up.
One of the precautions they've taken here at the firehouse to keep these first responders safe is they've barred any visitors from entering. That includes us. So we're shooting this entire story from outside of the actual firehouse and doing interviews in these adjacent buildings.
Even though you're my brother and you're here doing the reporting, you guys have all maintained your 6 feet distance.
For many first responders, there's simply no off switch during this crisis. For my sister, it's particularly intense. Her husband and now her 16-year-old son are also firefighters. She has 2 more kids at home and an elderly mother-in-law to take care of.
And then the stress of our families. Do we bring it home to our families? Do we get quarantined here at the firehouse? All that kind of weighs on you when we're out there providing care.
But my sister, her family, and the rest of the volunteers, CGTN, Pikesville, Maryland.